North Carolina could make some major changes when it comes to your health care after years of battles over it. Good evening, I'm Rod Carter.
I'm Angela Taylor. Today, Republicans who spent years blocking efforts to expand Medicaid coverage now say it's time to do it. Our Capitol reporter Michael Hyland is live in Raleigh. And Michael, it's not the only change they want.
Right, expanding Medicaid is the major part of this bill that deals with access to health care, but there is some pushback to some of these changes. The political battle over access to health care took a major turn in North Carolina Wednesday. Leading Republicans in the state Senate are now backing a bill that would expand Medicaid coverage to about 600,000 low-income people. One by one, they talked about how they were some of the leading voices opposing this for years, and then they made the case for it.
I think this bill is a rescue plan for our hospitals, especially our rural hospitals.
We are losing providers at every level of health care within the state.
This is the right thing for us to do.
Democrats, including Governor Roy Cooper, have pleaded with them to take this step.
I hate to say I told you so in terms of the working poor.
The federal government pays the vast majority of the cost, with the state planning to cover its share through an assessment on hospitals. Expansion would end if the money ever falls short, but Senate Leader Phil Berger no longer thinks that's likely. He says other changes need to happen too.
You end up creating longer lines for folks who already have insurance coverage. Then we really haven't helped in terms of access.
Republicans want other reforms, including for certain nurses to be able to practice with less supervision from doctors. That's something that concerns the North Carolina Medical Society, which represents physicians.
But we think the inclusion of this is a significant harm to this bill and to potentially to the citizens of the state of North Carolina.
Many Republicans in the House don't support expanding Medicaid. If the Senate passes this, it's not clear if the House would even bring it up before lawmakers leave this summer. A spokesman for Governor Cooper did not say explicitly if he would sign this bill. He did say that Cooper is encouraged to see progress and will carefully review this. Live in Raleigh, Michael Hyland, CBS 17 News.
All right, Michael, thank you.